And welcome back to Daybreak OC. The time now is 7:34. I'm Shali Zamarodi.
I'm Pete Weitzner. It's Wednesday, September 3rd. Okay, does your child dream of becoming an Olympic athlete? They all do now,
yes.
Right? Maybe being the next Michael Phelps. Well, this morning we're talking with Dr. Marcia Whalen. She specializes in sports medicine, and she has tips to get your child physically prepared for competition.
Good morning. Thanks for being with us.
Good morning.
Today.
My pleasure.
So you volunteer your time to do this, right?
That's right. I do.
Why?
Well, I'm a personal physician, and I'm board certified in family practice as well as sports medicine. And in my everyday practice, I help to make sure that my patients are not harming themselves when they exercise and to train. And so just taking it to the next level of what I feel is the most important elite athlete at the Olympic level, where they're not paid. They do it purely out of the love of sport, and they want to bring home gold medals for the U.S. So to be able to volunteer my time to help those athletes at that level is, I think, the ultimate volunteer job.
We also have pictures of Michael Phelps' mom with every win, and there's a lot of would-be Mrs. Phelps out there who want, whether it's swimming, water polo is your sport where you train. What's the good advice for moms, say their kid is very young, 7, 8, they want to start, what's the advice so they do it right?
Well, I think the biggest concern at that age, pre-adolescent age, under 12, under 13 years old, is that parents focus too much on one sport for their child. The American Academy of Pediatrics has put out recommendations that it's much more appropriate for a child at that level to be involved in multiple sports, to be cross-training, if you would. They recommend that a child not be in the same sport more than 5 days a week.
Repetitive motion injuries.
Exactly. And these young bodies are just growing.
Right.
And so you want to maximize the coordination and the fundamental skills by having them be involved in different sports at that level and not really focusing on a single sport until they go through puberty, essentially. So anything under the age of 12, if you're on a travel ball team, for example, which a lot of kids are in Orange County, it can be very detrimental to the body.
I didn't even think about that, as it would be repetitive. But for those that do have their kids involved in those types of sports right now, are there things that they can do besides, you know, varying what they're involved with to prevent injuries?
Absolutely. I think the number one thing, and what I do in my own personal physician practice, is really keep an eye on your child and look for signs of overtraining syndrome, especially if your child's in just one sport. So some of those things to look for would be chronic muscle or joint aches. You know, at a young age, that just shouldn't occur. The other thing would be fatigue, general fatigue. Same thing, in a young child, they just shouldn't be tired, especially from sport. Also, a change in personality, dramatic change of personality, and just a sheer lack of enthusiasm or excitement for their sport or for their games. You know, even going to practice or to a game, when a child suddenly doesn't want to do it, that's a sign that there's some overtraining going on.
You were, a few months ago, you helped train the women's water polo team, silver medal, congratulations.
Thank you.
Did they give one to the trainer?
No.
They don't?
No.
You know, in sports, they give them to...
Unfortunately.
We need to change that rule.
That's all right.
What was that like? And what do you specifically for women's water polo? What's some of the training you do?
Well, I don't so much participate in the training as I'm there to help them prevent injury as well as treat injuries when they have it as the team physician.
Sure. Everyone's playing hurt in one way or another, right?
Yeah, or how common are injuries? Do they happen often?
At that level, at the Olympic level, absolutely. There's a lot of overuse injury. And really, you know, having the trainers there and having the proper training going on is not a problem when you have the level of help that you have at the Olympic Training Center or, you know, in any Olympic athlete. So translating that into everyday preventative medicine can be quite difficult when you don't have those resources there.
Look at the track and field. It costs a number of, that's what, you know, one area where the U.S. didn't do so well because of injuries.
Correct. Correct.
How do you explain, Doctor, the amount of success all the Orange County athletes and the almost dominance of Orange, you know, for one area, right? I mean, from swimming, you name it.
Must be all that California sunshine.
I thought you were going to say must be the trainers. Is there something that we wouldn't think? Of course, we have sunshine. We can play sports 360 days, 5 days out of the year. But.
Well, I think you'll find that when the Winter Olympics come along in 2 years, you won't have quite as many Orange County residents. You would be surprised, but certainly I think the weather and the dominant swimming and dominant water polo in Orange County and in Southern California is the #1 reason.
If we had Phelps, it would have been all over. Surge these days, they say people interested in Natador's program, much more interest now in young people, even more than before, right?
Absolutely. I think one of the cautions I would have for the parents of my patients is, these kids, not everybody's a natural athlete. And even when you listen to the interviews from Michael Phelps, it wasn't until he was about 11, I believe, is what his coach talks about, is when they really noticed that he had a gift. And then he had the proper training for it.
Right.
He wasn't swimming competitively at the age of 7 or 8 or 9, like most kids are now.
Yeah.
So look for that glimmer. Dr. Whalen, thank you very much. Pleasure to meet you.
Thank you.
Being here.